ما كثير من انواع البلازما. There are different types of plasma. There's PRP, which is plasma-rich platelets. There's plasma pool platelets. So we have to understand what's different terms so we can get the right message. So PRPs is a sequestered and concentrated platelets and white blood cells in suspended plasma. Definition of PRP. So the normal platelets count in the blood is usually range between 150 up to 450 platelets in cubic millimeter. So to get PRP, we have to get like 4 to 6 the baseline. And the second point, an important point, that we should have like a dual spin processing system for that. Because now in the Europe, North America, and here as well, many people are using plasma, but it's not really PRP. To get PRP, you should have dual spin. What's meant by dual spin is you can have like a soft spin and a hard spin. So the soft spin is usually at 2,600 PRM. And the purpose of the soft spin is to separate the RBCs from the plasma. And later on, you get the hard spin where you'll be able to separate the platelets and you get the PRP. It's important to get an anticoagulant like ACDA. And PRP usually contains concentrated white blood cells to counteract infection. So let's take a look at the mechanism of PRP. So PRP for stem regeneration therapy use components called platelets, as we all know. And platelets have growth factors. And these growth factors usually modulate the immune response and the different metabolic pathways in human bodies to induce collagen production, generation of new capillaries, and rejuvenation of skin. Moreover, white blood cells exert a synergistic effect, resulting in about 5-fold increase in the amount of growth factor released. And in premium PRP skin regeneration, the growth factors cocktail is supplemented with specific growth factors injected to ameliorate skin problems. So what are the different growth factors? We have the PDGF, or platelet-derived growth factor, which promotes cell growth, new generation and repair of blood vessels and collagen production. We have also the FGF, or the fibroblast growth factors, which promote tissue repair, cell growth, collagen production, hyaluronic acid production. Another growth factor is the vascular endothelial growth factor, which promotes growth and new generation of vascular endothelial cells. Epithelial growth factors promote epithelial cell growth, angiogenesis, promotion of wound healing. Tumor growth factor beta, which promotes growth and neogenesis of epithelial cells, and vascular endothelial cells promotion for wound healing. So the efficacy of PRP. So we can use PRP in cosmetics or plastic surgery to augment and improve the nasolabial roof, to get rid of fine wrinkles around the eyes and wrinkles on the forehead, wrinkles on the neck, wrinkles on the lips. It can improve acne marks as well, and sags and dark circles under the eyes. If we look at anti-aging, wound healing, and plastic surgery applications of PRP, usually for wound healing, reduce seroma and hematoma formation. It reduces inflammation. It promotes wound healing and shorten the period of wound healing. As we all know, wound healing passes into stages. The first stage is hemostasis, followed by proliferation and collagen synthesis and remodeling. And with PRP, you can really shorten this phase. It can reduce scarring, it can reduce pain, counteract infection. It can be like a skin rejuvenation modality and somehow filling. It It can be used for hair restoration. My own experience started back in 2005 in Europe. I have like total of 459 patients treated in Europe, North America, and Saudi Arabia. This is an example of not just PRP. This is an example of like a combination of therapy and cosmetic or aesthetic surgery. Like PRP by itself is not a treatment or a cure of skin problems or any beauty problems we're facing in our clinic. Like this patient, usually if you can see the mark in front of the ear, you would say that, or you can tell that she had like a facelift with her preocular incision. But she had as well fat grafting combined with PRP. And you can tell the augmentation of the cheek, of the nasolabial fold, and the better skin texture after these combination therapy. So just 1 week after, so it's a remarkable result. You can take a look here at the nasolabial grooves and the marionette lines in a 72-year-old lady. So the picture on your left shows that just before the injection, and the one on the right just 2 months later, which marked improvement. In the nasolabial groove, you can see just before injection with marked lines, and 2 weeks later, it's almost like a filler, as you are using like hyaluronic acid or any other calcium hydroxide type filler.
Can you do this combination fat and plasma or was only plasma?
This patient?
Only plasma?
Just actually, you have to differentiate and you have to be very precise with your terms. So plasma is something and PRP is something else. Okay? So anything just below 900,000 platelets per cubic millimeter is plasma or plasma pool platelets. So to get PRP, you should have like more than 900,000 platelets in 1 cubic millimeter. So if you have less than 900,000, this is not PRP. Okay? You can take a look here at the wrinkles and dark circles around the eyes. The picture on the left just before injection. You can see those sacs, depression, and just 2 weeks later. You can see the sacs under the eye. This is 60 years old gentleman, just before injection, and just 1 month after. Another example of the nasolabial fold and wrinkles under the eyes of 72 years old woman, just before injection and 2 months later on. So what about PRP in real life? So PRP enrichment is increase the cellular survival and the proliferative potential of cells. And if you combine it with fat grafting, it will actually give fat survival. Platelet-rich plasma actively mixed with 1 ml of centrifuged fat tissue for reconstructing the 3-dimensional projection of the face to restoring the superficial density of facial tissues, and usually gives remarkable results and usually long lasting. And these results were obtained have proven its efficacy of these combined treatments. This is a study I made like in 2007 in the Analyse Chirurgie Plastique, the French analog of the American Anatomy of Plastic Surgery. And as we know, like fat, if you're injecting fat in the body, you have to know in the first 6 months you have a resorption from 20 up to 50% of the fat being resorbed in the first 6 months. But if you combine PRP plus fat, you can reduce this amount of resorption up to 10%. So there's a remarkable difference between just fat injection alone and fat injection combined with PRP. Regarding the outcomes, PRP has proven its efficacy in infection reduction for treatment of chronic wounds. It enhances the recovery. It reduces the surgical intervention and subsequent surgical intervention, debridement, and so forth and so far. It reduces the office and physician visits. It shortens treatment regimen and other post-operative